FaithCare began in 1994 to bring healing to some of the neediest people in this world, while also meeting spiritual and emotional needs, bringing health, hope, and healing. Through health fairs, community outreaches, and international missions, we've treated hundreds of thousands of patients, performed tens of thousands of life-saving surgeries, and seen hundreds of thousands receive spiritual counseling and hope. But we're not stopping there. From the beginning, our vision has been to have permanent healthcare facilities where we can not only provide ongoing care, but also train the next generation of faith-minded healthcare providers. We have had several FaithCare clinics in the United States, seeing patients on a regular basis, and our goal is to have international hospitals where care can be delivered in remote and needy areas, as we have done on short-term trips to Haiti, Nigeria, the Dominican Republic, and Siberia. We are one step closer to that goal. Immediately before the pandemic, we were given the green light to start building our first international hospital in Nigeria. We acquired land in Kuje, a semi-urban rural suburb of Abuja with numerous low-income residents. Abuja is centrally located in Nigeria, making it accessible to many of the patients that we aren't able to provide care to during our regular outreach programs in the more rural states of the country. Here you can see the start of the building project, when our founder and CEO, Dr. Peter Schnatz, led a team to Nigeria in early 2020. Because of FaithCare's widespread network within the United States and abroad, we were able to continue providing care to rural Nigerian villages during the pandemic, while also raising the funds to build Phase 1 of the hospital. Here you can see what Phase 1 will look like. The FaithCare Nigeria Kuje Hospital will serve more than 2 million low-income residents in the greater Abuja region.
One of the hardest parts of our short-term mission projects is not being able to treat everyone who needs it, who comes to see us during an outreach. This new hospital will treat those types of patients where our short-term trips were not able to meet those needs. And those patients with more complicated problems who need hospitalization will have that opportunity as well through our new hospital. Patients from the Kuje community currently travel long distances and pay exorbitant fees at government hospitals. However, the FaithCare Hospital will be charging lower fees, and best of all, the FaithCare services will be provided in an atmosphere of Christian love and hope. Patients can get the lowest price treatment in the Abuja region while also having their spiritual needs met.
The hospital is operationally designed to self-fund within a period of 2 years. Donations will be used to cover additional costs through an indigent patient fund. This hospital will be a fully functional missionary and teaching medical facility, the only one of its kind for about 300 kilometers. We plan to have faculty from both the USA and Nigeria, along with rotating medical students, residents, and fellows from Nigeria and abroad. Dr. Monday, our Nigerian director and a seasoned surgeon, will be leading our medical team. Because it will be a teaching hospital, the expertise and experience he and volunteer specialist doctors will bring will be passed down to trainees. The Abuja Teaching Hospital is 50 kilometers away, and we plan to host some of their trainees.
I'll also be overseeing an exchange program for American students, residents, and trainees interested in tropical medicine. In essence, we will be training the next generation of faith-based medical care providers.
Phase 1 of the hospital is being built. Now we need your help for the final push, to complete the finishing touches, such as light fixtures and faucets, supply the hospital, and raise funds for 2 years' worth of staff salaries.
If we can be successful in this, by God's grace, we hope to open the hospital in February of 2024. Won't you please help us? Not only will you make it possible for patients to receive much needed medical care, but they'll also have the opportunity to receive hope and peace. Furthermore, you'll be helping to train up the next generation of faith-based healthcare providers to ensure that this work will continue for years and even decades to come. Imagine the joy of meeting a need that otherwise would not be met.
If you would like to be a part of what God is doing through FaithCare, please contribute today. You can even name a room or donate a plaque in honor of your family or a loved one. Anything you can do will help make a huge impact. Help meet that need today.